They're all very different. So therefore, when we treat them, we don't treat the diagnosis, and we treat who they are and what they have.
Dr. Jingduan Yang is a psychiatrist and a fifth-generation practitioner of traditional Chinese medicine.
And initially, he was very paranoid, and he was very shy, and he was very isolated.
Today, Dr. Yang will talk about the differences between Asperger's syndrome and autism.
The people with autism and Asperger syndrome can have various kinds of biochemical imbalance. And we have found that the majority of autistic spectrum disorders, including Asperger syndrome, suffer from what we call under-methylation. And the brain needs this process to produce neurotransmitters. People always wonder whether or not there's difference between Asperger syndrome and autism. Actually, according to new mental health diagnosis, Asperger syndrome doesn't exist anymore. They put it as autistic spectrum disorder. But in reality, they are very, very different. So people were actually arguing they should not be mixed together. Let's dive into the differences and similarities of these two conditions. Let's start with Asperger syndrome. You may have known some famous cases of Asperger syndrome. Elon Musk actually said he had an Asperger syndrome. Everybody knows how successful he is and how intelligent he is. Asperger syndrome normally has above average intelligence. That is very different from autism. Autism normally have below average cognitive capabilities. Some people even argued Thomas Jefferson had Asperger syndrome. If you really look into his some peculiar behavior, you would wonder whether or not he does. The second difference is that the diagnosis is normally very early on with autistic kids. They're normally, in average, diagnosed at around 4 years old, because you will have noticed some abnormality at that time, particularly the delayed language development. On the contrast, the child with Asperger syndrome never had a language delay, so you won't notice the problem. The autistic kids actually feeling awkward to interact with other people. Asperger syndrome, they're eager to interact and socialize with others, except when they start doing that, it is pretty awkward. So people normally don't notice the problem even until the late teens or even in their young adult life. That's the time they begin to demonstrate the issue with socialization. They're normally having trouble keeping relationship or being socially awkward. The people with Asperger syndrome tend to have some special talents, and they can become expert in certain areas. They can be a great mathematicians, they can be the great engineers, or entrepreneurs like Elon Musk. Not only the difference between their intelligence, cognitive functions, their socialization, if we analyze their brain is different too. The brain EEG actually shows that people with Asperger syndrome have a strong neurological connection in certain areas, while the child with autism does not have the same kind of neural connectivity. One of the reasons that contribute to the late diagnosis of Asperger syndrome because their symptoms is relatively mild. You don't normally notice that until very late. When they hit puberty or when they become teenagers or adults, we begin to recognize they have a pattern of behavior making them uncomfortable in a social setting. Very often, they also have a challenging in their relationships. Just like Elon Musk, he has married many times. It seems like he does have a problem keeping a relationship. In my practice, I do see a distinctive differences between these two groups of patients. And the patients with Asperger syndrome, they tend to be very well developed academically. They have a very stable job. Some of them are pretty accomplished. But they do have a consistent struggle with their relationships, and they don't feel comfortable interacting socially with other people. On the other hand, all the autistic child we are dealing with, they're all in their own young age, from the 2 years old to about 11 years old. And this kind of range of the patients we are seeing and we're helping them, they obviously have a very common features such as language delays, learning difficulties, and the repetitive behaviors. They're very picky eating habit. Despite the difference between these two conditions, there are some similarities. One common issue is they have trouble with relationships and communications, particularly in socialization. Even within each diagnosis, everyone is different. They share some common symptoms features as we have described, but they're all individually different. It is the same situation when we analyze their biochemical status and electrophysiological conditions. They're all very different. So therefore, when we treat them, we don't treat the diagnosis, and we treat who they are and what they have. And there are several factors involved in the development of autism or Asperger syndrome. For example, one patient with Asperger syndrome who is 23 years old now and who is very social. He runs for Rotary clubs and he plays tennis. He goes to the singing classes after our treatment. And initially he was very paranoid and he was very shy and he was very isolated. Once we improved the balance of his brain biochemistry with nutrients, all those improvements have happened. We also have treated kids with autism, and our most recent case was a 4-year-old boy, and he had trouble speaking, expressing himself, particularly keeping eye contact when he was speaking. He threw out a temper tantrum periodically, and it could last a long time. So just after 1 month of treatment with nutrients that balance his brain biochemistry, he has a lot less temper tantrum. He began to look at people's eyes when he speaks, and he began to communicate, express himself verbally and non-verbally much more than he had done a month ago. The people with autism and Asperger syndrome can have various kinds of biochemical imbalance. And we always look into their gut, for example. The gut health has a lot to do with the brain health and brain development that determine how they absorb nutrients, that determine whether there is a leaky gut that causes inflammation to the body and to the brain. We always look into any kind of toxicity, particularly heavy metal toxicities, and also imbalance between important minerals like zinc and copper. Another very common situation that happened to these people is they're having a methylation problems. They normally have an insufficient amount of methylation that cause problem for the brain to produce normal neurotransmitters they need. Methylation is a biochemical process. The one molecular donate a methyl group, which is CH3, to another molecular. That's called the methylation. And the brain needs this process to produce neurotransmitters. And DNA needs that to repair and replicate. So it affects our immune system. It affects almost everything that we do in our body. And we have found that the majority of autistic spectrum disorders, including Asperger syndrome, suffer from what we call undermethylation. And unfortunately, a lot of people with autistic spectrum disorder had methylation issues from the time they were conceived and developed during the pregnancy. That leads us to other questions. How do we prevent autism from the time of pregnancy? Of course, vitamin D deficiencies, essential fatty acid imbalance all contribute to that. Fundamentally, autism and Asperger syndrome, or we put them together, call them autistic spectrum syndrome today, is an interaction between genetic predisposition and the environmental factors. And that starts from the time they're developing the womb of their mother, and from the early years of the birth, including the process of birth. When kids have natural births, they're able to have a healthier microbiome in the adult's life. I think that might contribute to the problem with autism as well. That's why they have a tendency to be very sensitive to food, and they have trouble with digestions, and we frequently find there's a dysbiosis and inflammation in the gut.
Dr. Young will be back with another talk on autism next week. For more information on his treatments, you can head over to the Young Institute of Integrative Health.